Ladies and gentlemen, you're welcome to another session with Dr. Fresh, and we'll continue our series on sickle cell crisis. Moving on, we're looking at other risk factors for sickle cell crisis. We established that we have what we call the painful crisis, where the patient has so much pains in their joints that could last for days, weeks, and all of that. Vaso-occlusive crisis. And the last episode we said physical stress, emotional stress, psychological stress are things that could contribute to crisis. In this episode, I want to let you understand that pregnancy is a stress of its own, and pregnancy itself can put a client at risk of crisis. Second one I want to talk about in this episode is infection. That's why when a sickle cell patient goes to the hospital, not often than not, they always have to do a full blood count, let you know whether there's an ongoing infection in the blood. Infection is a problem. When a sickle cell patient has an infection, it's a fertile ground for crisis. Number three, it's interesting to know that beyond physical stress and all of that we talk about, beyond infection, beyond pregnancy, sometimes, just sometimes, poor sleep may be the problem. Some clients, some patients, they do not sleep well. They have insomnia because of the pains they've had in time past or re-ensuing pains. So they do not sleep well, and then this poor sleep can become a fertile ground for crisis. It's also interesting to know that some may embark on long journey and they may take a flight. So when you have to travel on high altitude or be on high altitude, the level of oxygen concentration at higher altitude is reduced. So the oxygen that gets to the red blood cell is even more reduced. Because of that, they are now prone to crisis. In the next episode, we'll see a list other possible risk factors that can pose a threat to a patient, and patient will come down with crisis. Remember, when you like this video, you give it more visibility so that others out there can learn what you've learned. And then when you share, the shared knowledge is a developed knowledge and will help make society a better place. You know what I usually say? That if you know better, you definitely do better. I'm out of here.